Continuing the previous video, we talked about dissecting instruments. Now we talk about instruments that are used to connect tissue or suture. You only need two instruments here. The first instrument you need is a Hager's needle holder and the needle. These are the two instruments you need. That is it. Then we have two types of needles. There's one needle with a taper point end. This needle with the taper point end is used for any other tissue apart from skin, because you do not want to leave these circles around the skin. It will be very tough for the skin to heal. Then the second type of needle is a conventional cutting needle. The conventional cutting needle leaves a triangular incision, and it's easy for skin to come together when you're using this kind of a needle. Okay, so basically these are the two instruments you need for making a suture, and you hold the needle holder the same way you hold the scissors. Thumb through the first hole and the fourth finger through this hole, while it's using the index for support. The next instrument we talk about are the accessory instruments. The accessory instruments are divided into the following instruments. The forceps or pickups. These instruments are used for picking up tissue and also holding blood vessels when they are bleeding, and they are also used for skin for holding skin when you're making a suture. So the first instrument we talk about is a DeBakey. The DeBakey is used for grasping blood vessels. It has got very, very beautiful hands. As you can see, they are serrated, but they do not have teeth. No teeth whatsoever. This is in comparison to the Hudson pickup, which has got teeth at the tip. Okay, so the Hudson has got teeth over here. You can see that teeth. The Hudson is therefore used for skin. You use this Hudson for skin, and then you have a bigger form of an Hudson. The Hudson is quite small. There's one which is bigger. It looks like this. This is going to be known as a toothed pickup. Okay, and then this is a Russian forceps. It is used for removing a tissue. You can, if you had, for example, a perforated intestine and you had fecal matter in the stomach, you're going to use this instrument to pick up the fecal matter, known as the Russian forceps or Russian pickup. So how do you hold a pickup? This is how you hold a pickup. Thumb finger on one end, and on the other end, the index finger or all the other fingers together. Okay, the other accessory instruments we have are forceps. This is a very important part of surgery. We have the first forceps, which is known as the backhouse forceps. The backhouse forceps is used for for holding drips, and this instrument, I'm not sure I have a picture of it, but if I do come across it, I'll show it to you. It's a very interesting instrument, and it's used for putting towels on the patient to just divide the operating environment from every other part of the body, so that you could know what part of skin you'll be concentrating on. And then you have retractors. Retractors are basically used to make the wound incision a little bit larger for you to see the deeper organs. Retractors, we have the Devers retractor, which is used for quite deep operations. For example, cholecystectomy. Use this instrument at making a mini incision. Use this instrument to hold down intestines and part of the large omentum as well. And then you have the Devers retractors, which are over here, which we just talked about. It's a Devers retractor. And then you have the Richardson retractor. The Richardson retractor is also known as the Reach. Where is the Reach retractor? Over here. The Richardson retractor is very, very, very beautiful. It has got hands that face in this direction, and we use this instrument for basically any operation that is not so deep. For example, herniography, you can use this instrument to divide the ends. And then you have a an Army Navy retractor. This Army Navy retractor is the most used retractor. This Army Navy retractor is also known as a Farabee retractor. This retractor has got one short end and one long end, and when you place it through tissue, it helps you retract with this side, which is a little bit longer if you need to go deeper, and if it's not a deep incision, you can use this end as well. It's a very, very comfortable retractor. And then you have Murphy Rex. Murphy Rex are used for small incisions. Basically, we use these for cysts. When you have to remove a cyst, for example, an anecyst, which is tough tissue, and you need to have that grasping division, you use these retractors. We also use this for tracheostomy sometimes. Talking about clamps. Clamps are very interesting and very important actually, because we use clamps for grasping tissue and tying. So if you have a bleeding blood vessel, you basically clamp it with this forceps. So you go and you clamp this blood vessel, and then you pass a knot like that. When you pass a knot like that, you then cross the knot and then tie all the way on the blood vessel. And then when you tie on the blood vessel, you're going to have something like so. This is the blood vessel. This is the blood vessel, and you have a string over there attached, which you just put on. This is the string, and then you're going to have the forceps over there, which you had placed the forceps. You had placed the forceps like that. Of course, this is not the best of diagrams, but I'm trying as much as possible to make you understand just how you place these forceps. So basically, you tie below the forceps, and when you tie and let the forceps loose, the blood vessel remained hemostatic. So you would have performed primary hemostasis. Anyway, the mosquito forceps has got lacerated hands. As you can see, they are lacerated, and the distance from here to there is quite small. This is a Kelly clamp, because the distance from there to there, the distance from there to there is almost equal. Okay, but this is a mosquito. Yeah, this is a mosquito clamp. Further on, we have a Mayer's clamp. Do I have a Mayer's clamp somewhere? Let's have a look. No, we do not have a Mayer's clamp, but a Mayer's clamp has the following. Mayer's clamp has got a larger end and a smaller beginning. It's used for deeper clamping of tissue. Basically, these are the three clamps that we use. It's used for grasping tissue, usually on vascular tissue, and we also use it for grasping the peritoneum when you have to make an incision on the peritoneum. I will explain about this better on when we'll be talking about operations. And then you have a Coker's forceps. The Coker's forceps has got a very, very great laceration, and it has got good where do you have the Coker's forceps? The Coker's forceps, oh my lord. Basically, it's a combination of the Alice. This is an Alice, and the Kelly. So what a Coker's forceps would look like is that you would have a Kelly with teeth. So this is a Kelly, yes. This is a Kelly's forceps over here. I think we just need to find a picture for this to make it beautiful. This is your Kelly. You need to have teeth over here in order for you to grab onto tissue. The next instrument we'll talk about is Alice instrument. The Alice forceps is used for the same function as the Coker's forceps, except with the Alice you have to grasp onto a tissue that is much more thicker, for example a breast lump. And then you have a Babcock's forceps. A Babcock's forceps is over here. Babcock's forceps has got the same function as the Alice, except you don't use it for thick tissue, you use it for intestine. Okay. Next forceps we talk about is the right angle forceps. The right angle forceps is used for cholecystectomies, when you have to hold on to tissue, and as you are holding on to tissue, you basically have to make the right angle. This is a very, very important forceps, and I hope you come across an operation where we use this forceps. I'll send a video about an appendicectomy where we have to divide the appendicular artery from the appendix, because the appendicular artery is running through the mesenterium, the mesoappendix, which is attached to the appendix itself. So you have, for example, this is the appendix, then you have the appendicular artery over there, which sends some branches like that to the appendix, right? These are some branches descending. Branch, another branch, another branch, another branch, another branch. So what you basically do is you use this right angle to enter through that position. This is your right angle forceps, which just entered over there, and then you're going to get a string, pass it like that, grip the string and remove the right angle. So the string will come over like that, and then you use the screen to basically tie over here. And when you tie over here, you then cut with the scissors like that. Because you have made the tie over here, there won't be any bleeding through these accessories. I hope you understand what I just drew over here. Okay guys, thank you so much. We are done with this video.